us about the relationship that we have with UNC.
Sure, I get asked this question a lot. We review it every 2 weeks at new employee orientation because it is a complex system. It's an academic system, as you know, and it really spans the entire state. And so a lot of questions about our relationship. As we've talked earlier, there are certainly individuals who believe or have believed that we are owned by UNC, and that is not the case. So in 2014, the Board of Commissioners for Nash UNC Healthcare decided to affiliate and become associated with UNC. And what that means is that we have local leadership, a local Board of Commissioners, local decision making, and our investments in this community, whether it's in new services or assets, medical office buildings, new CT scanners, MR, is all done by Nash,
right.
And we're responsible for our own finances. And so we get to tap into the UNC health system. As the viewers can see on the screen, it really does expand or span the entire state. There's about 14 different hospitals. About half of us are owned or affiliated, or owned, and about half of us are affiliated like Nash. And that really means that we're able to tap into the partnerships and the benefits of UNC. And so I think the next slide will talk a little bit more about what some of those benefits are. And so, for instance, the system, and we had access to Epic, at what we call Epic at UNC, and that is the electronic medical record that our nurses, our allied health, and our physicians use to chart and communicate about patient care. And the uniqueness of having it across the entire system is that if you needed a specialist at UNC, that individual can access that record real time while you're on the phone with them. So as their hospitalist or their physician is here in Rocky Mount talking and seeing the patient, they can actually access a specialist who can see the record in real time and read the chart. And so that has been invaluable. We have several different opportunities there that I've witnessed how we've improved patient care through having that connectivity.
And Dr. Prasada was talking about if a patient here needs to go for open heart surgery, that they can just seamlessly use that system to communicate with them, and often the doctors from here, because they are UNC employees too, follow them up there. But Dr. Isley, I want to mention when that system, the Epic system came in, you have to be a certain size hospital to even be able to qualify to get to have it. And because we were affiliated with UNC, we got it, and we got it with the economy of scale, a better price point even because of them.
We did. We got a discount. I know that as I worked with the board, it may not have felt like a discount. Right. Still an expensive electronic medical record.
But they all are.
It is the lifeblood of the
But
hospital.
it is the lifeblood, and it was certainly, I have seen that not only from the patient care side, but the finance side, it was well worth the investment. And so,
right. It all translates into the mechanism by which we talk to each other.
That's right.
Very effectively to deliver quality care. And without an effective electronic record program, we simply can't deliver the care in a timely or a cost-effective manner.
And it's hard to communicate, and that certainly slows down patient care and leads to complications if there is any confusion. And so the other benefit is UNC Physician Network. We talk about this a lot. So it is a sister organization that has been stood up by all the affiliates and owned hospitals, and it helps us operate the day-to-day practice, our outpatient practices. So it helps us operate our urology practice. It helps operate the day-to-day surgery practice. Our otolaryngology or ENT practice are just examples. And so they kind of take care of the day-to-day. Crystal and I are very involved in the strategic operations of that. We meet on an ongoing basis with PN to make sure that we're talking about how we expand services, what services we should offer, and those types of discussions. But the day-to-day, how you make an appointment, PN helps us operate. Nash is responsible for any shortfalls between the cost of operating that practice and the revenue it generates. So it really is our practice, but they're a vehicle that we use. That's their expertise. That's what they do every day across the state.
Did you mean by that if a practice is losing money, but is providing an absolutely necessary service to the community, Nash eats that financial loss in order, but maintains that vital service for
That's
the
right.
community?
And that's part of what we do as a not-for-profit hospital system.
And that's an amazing point because, for example, I'm not part of the UNC Physicians Network, but I provide services to the hospital. But there are some services that simply cannot support themselves as a private practitioner. For example, our trauma service. Right? Impossible to support yourself as a trauma physician by yourself, but to have the financial support of the hospital, even though there's times it may lose money. It provides an absolutely necessary service to the hospital. If somebody breaks their leg, they need to know that somebody like Eddie Hasty is waiting there for them.
And I saw Eddie in the operating room this week, and there were 3 or 4 patients who did benefit from that service.
Oh, every day.
And every day. So the others, cancer and cardiology, here are great examples of how our relationship with the academic medical center brings quality care that a community our size just could not afford or have the expertise that we're able to tap in to the expertise of an academic medical center. We may have a patient and a physician here locally. They may have a surgery at Chapel Hill, and then once the patient is able to be transferred back closer to home, that happens seamlessly because of that communication through the electronic medical record, through the cancer committees, and the work that we're doing every day. Cardiology, that relationship is actually with the School of Medicine, and so we're tied directly into the School of Medicine, and those physicians who are doing over 1,200 catheterizations a year are even doing more back at the UNC Med Center. So they're coming back out and are part of our community, but also have access to UNC. So those are some examples of how we benefit through that affiliation. And then, of course, the helicopter, we have a helicopter station. Tar Heel 4 is stationed on our campus and available for us in the region. And so
that helicopter stays at our hospital.
It does stay at our hospital.
There's 2 helipads and 1 bird that's there all the time. And how many? There's 2 teams, correct?
That's right.
And a pilot's sleeping. He's got quarters there, so I mean we've had that going on.
So those
all
are
the time.
just examples of how we're tied into the benefits of UNC, but the final decisions rest with that 14-member volunteer board of commissioners who all live and work in the communities that we serve.